Mr. Chairman, your Committee on Health and Human Services has under consideration SB 1600 and respectfully recommends the bill to pass committee on rules as the bill is constitutional proper form.
The chair calls on Representative Wilmoth. Okay, the chair calls Representative Dunn.
Mr. Chairman, I move that when the Committee of the Whole arises report, it gives Senate Bill 1600 a due pass recommendation.
Thank you. The chair calls on Representative Solomon.
Thank you, Chair. Mr. Chair, will Representative Shaw yield to some questions?
Mr. Chair, yes, I yield.
Thank you, Mr. Chair. Mr. Chair, Representative Shaw, so you're a physician, and I thought you could enlighten the body. How do physicians currently handle situations where complications end a pregnancy early?
Thank you for the question, Rep. Salmon. So when there is an early end to a pregnancy, what we will do is speak to, depending on the circumstances, speak to the mother, the father, the family that are there, and have a conversation about their wishes, risks, benefits, consequences, alternatives of anything we do or don't do. That is part of the informed consent process.
Thank you, Mr. Chair. Mr. Chair, Representative Shaw, so how would Senate Bill 1600 change the current medical practice that currently the practice being very much evidence-based medicine?
To Mr. Chair, Representative Solomon, the bill would mandate that we would have to perform CPR or invasive measures on an infant like this because there would be a criminal penalty associated with not doing it. And anybody in the room could potentially allege that any of the activities that happen did not meet the intent of the law and therefore accuse someone else of a crime, which would then carry for any of those medical professionals a criminal penalty. And of course, every criminal penalty will then result in loss of licensure, loss of credentialing, and carry significant penalties for a healthcare provider. So what it'll do is it'll really, given the threat of criminal prosecution, that will significantly change the informed consent process, and I think will then influence people to make decisions that are not fully in the best interest of said parties.
Mr. Shaw, please wrap up.
Thank you. And Mr. Chair and Representative Shaw, so I'm hearing the criminal piece would disrupt the informed consent piece. And what are the consequences of mandating this feudal care onto a neonate?
So, Mr. Chair, Representative Salmon, sometimes care can be futile for the infant that's born, and especially with the number, taking the age, gestational age into account, there are situations in which there is no chance of survival for the infant. And the issue then is if you're causing CPR, for example, or endotracheal intubation to be done on an infant that has absolutely zero chance of survival, then you're doing something that I think gets into a very ethical gray area. And so if I can describe for a second, the CPR you're talking about, according to our, sorry, Ms. Chair?
10 seconds left.
Oh, it's rather invasive and fairly.
I'm sorry, never mind. I'm sorry. It's 3 minutes. I'm sorry. Never mind.
Sorry.
There was one. Never mind.
Thank you, Mr. Chair. So what it involves is doing chest compressions. Chest compressions on an infant of that size, according to our pediatric advanced life support guidelines, would involve pushing on the chest at 100 to 120 beats per minute at 1.5 inches of depth or a third of the diameter of the chest. The problem is when you do this even on adults, you're talking about breaking ribs. It happens. It happens all the time. But doing it on an infant of this age would mean not just breaking ribs, which are cartilage at that point, but also possibly damaging internal organs, the heart, the lungs. And so it gets to a point where if there is futility to this, we are concerned. This borders on a word I don't like to use in medical practice, but it borders on what we would call torture.
Thank you, Mr. Chair. One more question for Dr. Shah.
Please proceed.
Thank you. So you've shared a lot of critical information with the body of what this would do to informed consent, to evidence-based medicine, to providers. So in summary, how would you describe this bill?
Mr. Chair, Representative Salmon, I think the overall, the word I can think of is certainly unnecessary and harmful. I think that the informed consent process today works to make sure that physicians are treating each patient with dignity and respect according to their wishes. I think the way in which this would also hurt that we didn't talk about yet is that if there is this futility that we know about given the medical science, what would happen is you would sort of push providers to get into treatment for futility that is really abhorrent, rather than people having the ability to spend those last moments with the child that are precious. And I think a lot of people have expressed concern that's exactly what's happening. Instead of having a chance to swaddle and have those precious moments, which by the way, as an emergency physician, this has been me. I've been in this situation personally, and what we have done is exactly this, and allow the mother and father to spend time with that child. That's what I don't want taken away from anybody.
Thank you. Mr. Chair, will Representative Stahl-Hamilton yield to a couple questions?
Do you yield to a question?
Yes, Mr. Chair, I will yield.
Proceed.
Thank you, Mr. Chair. Mr. Chair, Representative Stahl-Hamilton.
Please proceed.
Your family went through this situation. Can you share that experience with the body?
Yeah, this issue, it's personal, and it hits really close to home. My sister-in-law, when she was about as many weeks along as you are, went into preterm labor, and it was, I just was counting back, it was April 15th, 19 years ago. And normally that's tax filing day, but it's an anniversary for our family. My sister-in-law, at 22 weeks, went into preterm labor, and her OBGYN their facility was not equipped to deal with this. And so she was then air-vac'd to a specialty hospital here in the Valley. Her husband had to drive across town to catch up to her. And when they realized that there was no heartbeat and that there was a reason she was going into preterm labor, the care team had to figure out a plan in this setting and come to some decisions. And we were down in Tucson getting phone calls, back and forth. It was, the whole family was involved. And what ended up happening was that it was a stillborn birth. There was no heartbeat. There was no breath. And one of the best things that my sister-in-law, when we were gathered around as a family trying to figure out in our grief how to be a family and be together in this extreme loss for a baby that we very much wanted, she said the most poignant part of all of that was when the nurses had bundled the baby and they put him in her arms. At first, she wasn't sure how she was ever going to be able to get through that, but the moment that she was able to hold her baby, she said something inside of her clicked into her Norwegian roots, and that was the piece where she could count hands and toes and have a few minutes with her child. I can't even begin to imagine being in that situation that is so hard and so painful with all of the moving pieces and the care team, for the baby to be whisked away and her not having those few precious moments together right after that birth.
Mr. Chair, Representative Stahl Hamilton, first, thank you for sharing that with the body. I'm not sure if you're aware, the bill states that a parent can decline care, but if a healthcare professional in the room disagrees with that decision and thinks that there is an opportunity to intervene, they can report the doctor to law enforcement for not going further with the fetal medical treatment under the threat of a Class 6 felony. So can you describe to us what the impacts would be on a grieving family who just lost a baby of having to describe what happened that day to strangers, to law enforcement, under the threat of their doctor being charged with a felony?
Members, point of order has been called. Who called point of order? Barbara Parker, please proceed.
Yes, on relevance and correcting the record on Rule 18D. There's been several inaccuracies stated. And we're also getting away from the bill.
No, we're not.
Rule 18D on correcting a mistake of something that was said.
Okay, so Representative Barbara Parker, your point of order is that under Rule 18D, a member shall not interrupt another except to correct a mistake. What is the mistake?
Thank you, Mr. Speaker Pro Tem. The statement was made that this would be a form of torture and that doctors won't know if they're violating the law.
Thank you.
And here's the answer.
No, hey, please, please,
Speaker Pro Tem.
Just one moment, please.
Mr.
Representative
Chair.
Parker, please, give us 1 second, please. Thank you.
Mr. Chair.
Representative Parker, it sounds like you have risen with a point of order regarding a mistake, but also a second point of order that something was said that was not germane to the bill. Is that correct?
Yes, that is correct,
Okay.
Mr. Chair.
Members, I'm going to rule that Representative Parker is out of order, but I'm going to encourage you, please, let's confine ourselves to the bill. And let's try to be sensitive. It's a sensitive topic, I know. That's why we have rules, right? So that emotions and so on that run high are sort of respected. But we'll go ahead and proceed, but let's please keep it to the bill as best we can. Thank you, members.
Thank you, Mr. Chair. Mr. Chair, so I will ask the question again, and I've read this bill multiple times, so I know all of the comments have been to the bill. So page 4, if members who are concerned about germaneness want to pull up the bill, line 32 says the requirements, page 4, line 28. says any health professional, hospital, abortion clinic, or employee or volunteer of a hospital or abortion clinic that has knowledge of failure to comply with the requirements of this section shall immediately report the failure to law enforcement. And so, Mr. Chair, Representative Stahl Hamilton, so in your example, the feudal medical treatment was not applied to the baby. And had this been law, and had a health professional in the room decided that that was out of line with this section and contacted law enforcement, can you please share with the body what that would have been like for your grieving family to then have to recap that horrible moment and horrible day to strangers under the threat of your doctor being charged with a Class 6 felony?
You know, that day and the days after were tough enough for our family, and especially...
Point of order has been called. Who's called point of order?
Mr. Chair, again, I'm citing Rule 18D, that we're correcting a mistake. It was quoted that they're going to be violating the law and that they won't know. That is not correct. Mr. Chair,
Representative Parker?
if I may be able to correct the record with the correct answer
Mr. Chair, you
of
haven't ruled
truth
yet.
regarding the bill.
She
Hold on.
shall not be talking until you rule
I'm
respectfully, Mr.
sorry.
Chair.
Yes, thank you. Okay, members, so under Rule 18D, to correct a mistake, it's going to have to be a clear mistake, a mistake the body would know, and something like a factual mistake, a date is incorrect or something. I don't want to rule that something someone says in a debate is a mistake merely because there's different philosophical opinions on that. I'm going to allow Representative Solomon to ask one more question. We do have other people on the board, and so then we're going to have to move on to the next person. Is
Wait,
that fair?
Mr. Chair, wait. Representative Stahl Hamilton currently has the floor. We've been interrupted in a dilatory way, which is also violating the rules, and it has violated our right to debate based on Part 1, Chapter 6, Principles of Parliamentary Law, Section 56, right to debate. So she still has the floor, and Mr. Chair, this was my last question to her. I would like, respectfully, since she made herself very vulnerable, talking about the trauma that her family went through, for her to have an opportunity to just answer the question. Mr. Chair, please.
Yes, Representative Solomon, thank you. Representative Stahl Hamilton, please proceed to answer the question.
Thank you, Mr. Chair. Representative Solomon. So in our family's state of grief, my sister-in-law, who had all kinds of medical interventions, but then also part of the aftercare, had a series of medications that she was also taking to try to help with her recovery, also ended up with an allergic reaction to one of those prescriptions. And so in the aftermath of all of this, in our grief and trying to figure out which end was up and how to be with one another and support one another, something like this, something that wasn't about helping our family deal with such significant trauma and loss, not only would it have been offensive, but it would have been a breach of our own, what we felt like our own freedoms and our own liberties and our own privacy. this would have been that would have been such an egregious overreach. You know, my family put such trust, and they were in a space with top medical care, and that was the only thing that they were clinging to, was the care that they were receiving in the middle of all this trauma. And to think for 1 minute that there was a potential that somebody could be criminalized because my sister-in-law had a stillborn birth, that is not how we treat pregnancy outcomes and pregnancy loss. I don't know what else to say.
Thank you, Mr. Chair. Mr. Chair, I rise to make a comment.
Please proceed.
Thank you, Mr. Chair. Mr. Chair, members, first I would like to thank both my colleagues, Representative Shaw for providing the provider's perspective on this legislation, Representative Stahl Hamilton for sharing that very tragic story. You know, when I looked at this bill, and just having been here for 7 years, you know, this is not the first time that we've debated this topic. And it's very upsetting just knowing that things can go wrong in a pregnancy, and thinking about the interference that this bill would have in that very difficult moment. I just can't think about, like, would I want that interference if I went through this? You know, and as Representative Stahl Hamilton mentioned, like, I'm right at that cusp where I would want the sanctity of that conversation between me and my provider, and that decision between me, my provider, and my husband to stay within us, and to have the choice of whether or not I would be able to comfort my baby if this were to happen. So yeah, this is very personal. And I just, I really think that we need to deeply consider, like, take all the politics and the rhetoric outside. Just think about the families who are going through this, and whether or not this is actually appropriate, or if this would actually have the effect of further traumatizing people going through a very difficult hardship in time. As was mentioned, what currently happens in these situations is based in medical evidence. It's based in compassion. There are high-risk specialists, neonatologists, who specifically work in this area. So there is nothing to be fixed here. We want to maintain the integrity and the respect for families who are going through this tragic moment. This is why I'm just urging the body to oppose this legislation that would interfere with that. Thank you.
Thank you. The chair calls on Representative Bliss. Representative Bliss.
Yes. Mr. Chair, will Representative Parker yield to questions?
Which Parker?
Mr.
Barbara
Chair,
Parker.
yes, I will yield.
Okay, please proceed.
Barbara Parker, Representative Parker, we are also healthcare providers, and I heard earlier the word torture and causing harm. I'd like to make sure that we set the record straight what we actually do as healthcare providers. Can you help me out with this?
Yes, I can. Thank you for that question, Mr. Chair, Representative Bliss. The bill requires health professionals to provide the baby with medically appropriate and reasonable care. It allows parents to opt out of care beyond that, but they cannot opt out of medically appropriate and reasonable care because the baby is born a live person and is worthy of the same treatment as any other human would receive. Also, Representative Bliss, the criminal penalties that were addressed are appropriate for someone when someone knowingly allows a baby to be born alive to die, if that's on page 4, lines 32 through 40.
And Ms. Parker, could you expand on protocols we follow, such as mentioned earlier, pediatric advanced life
Through the
support,
chair,
neonatal
please.
advanced life support?
Please proceed.
Through the chair, of course.
I'm sorry, Representative Bliss, will you repeat your question?
Yes, through the chair. Let's help our audience understand protocols we follow as healthcare providers, such as pediatric advanced life support, neonatal advanced life support, and perhaps comment on if we were to veer from those protocols.
Representative Parker.
Yes. The statement that that this would put them in an impossible situation in deciding care and veer from that, that is not an accurate statement at all. No doubt, doctors and nurses who work in these environments have difficult jobs. But this bill does not require of them anything more than what they have sworn an oath to do and what they would choose to do. It simply requires them to do what they can for every baby born alive, regardless of a prognosis. We also have a protocol for a 15-week-old baby. This means comfort and care and giving parents a chance to say goodbye. The bill also provides a 30-week-old baby protocol, providing the same treatment to a baby with a potentially deadly disease as you would a baby without the disease at the same age. This bill addresses those type of situations that have been testified to, when the baby is born alive at a viable age but has a diagnosis of a short lifespan. This bill says, don't hasten the baby's death by neglecting to care for the baby because you don't think she will live long. Give the baby the chance that other babies born alive always get. And a violation of this bill would require the doctor or the nurse to only knowingly withhold medically appropriate and reasonable care. That would be an intentional act.
Mr. Chair, Ms. Parker, another question.
Please proceed.
We heard earlier from our colleagues across the aisle what was described as, we know, as comfort care. Could you please describe the difference of following protocols and then when a death is declared, because we followed our protocols and did what we were trained to do, then we cross into comfort care, that in fact the two are not the same? Could you help us understand that?
Yes. Thank you. And this, let me add to that as well, it doesn't pit doctors and nurses against each other in this kind of care. It's not uncommon for nurses to intervene in with the doctors. Again, they have a duty to do this kind of care, and it would be knowingly intentional. The language is healthcare providers would have to knowingly and intentionally fail to provide medically appropriate and reasonable care.
Mr. Chair, one more question.
Please proceed.
Representative Parker, us being healthcare providers, can you explain the right to try, the medical right to have treatment and to try?
Representative Parker.
Thank you, Mr. Chair. Representative Bliss. This bill is about the right to try and the right to practice, to provide the care that is necessary for any human being born alive.
Mr. Chair, another question for Ms. Parker.
Please proceed.
Ms. Parker, I've heard quite a few myths and mistruths about this bill. Could you share and debunk some of those to help people understand the actual truth behind this bill?
Yes, Mr. Chair, Representative Bliss. It's vague. Doctors, they're saying that doctors won't know if they are violating the law. The answer to that is not true. Attorneys and judges all understand the reasonable standard, which is as old as the American legal system itself. Medical malpractice law has already worked out the reasonableness standard, and physicians are well acquainted with it. And the standard in the bill is the health professional has to knowingly and intentionally not provide all the medically appropriate and reasonably care. So, to say that doctors would be violating the law, or it would be torture, or it's vague, none of those are accurate.
Mr. Chair, another question for Representative Parker.
Representative Bliss, you may proceed. Members do be aware that under House Rule 12I, a measure may be debated for a maximum of 30 minutes. We're at just over 20 9 minutes. Please proceed.
Ms. Parker, some say this bill requires quote-unquote unnecessary treatment that deprives parents of time with their child. I think some were trying to allude to that. But when parents ask us that question, and this one breaks my heart, but I can say with confidence each time, when they say, did we do everything we could, how do we handle those situations?
Mr. Chair, Representative Bliss, the answer to that, this question that it deprives the parents of time with their child to say goodbye, the opposite is completely true. It's the opposite. This bill ensures parents have precious time with their babies. The bill merely requires health professionals to treat the infant with the same medically appropriate
Representative Parker.
and reasonable care.
Representative Parker, members under rule. Representative Grass, do you have a point of order or something?
I rise on a motion. Mr. Chairman, under Rule 12, Part I, members are allowed to extend debate with a majority of those voting who are present. Given the nature of this bill, I move that we extend debate by 10 minutes.
Second.
Okay, members. Members, there has been a motion and a second. All those in favor, okay, so the motion is under Rule 12I to extend debate for 10 minutes on Senate Bill 1600. All those in favor will vote aye. Aye. Those opposed will vote nay. Division has been called. Members, please return to your desks. Thank you, members. Please report to your desks. Division has been called. Members, please report to your desks. All those who, so the motion is Rule 12I to extend debate on this bill by 10 minutes. An aye vote would extend the debate by 10 minutes. All those members who are voting in favor would please stand for the clerks to count. Please stand if you are voting in favor. Speaker Toma is standing. The chair is standing. To repeat, members, please, let's keep. Members, please listen. So this is a Rule 12I. It's a motion to extend debate on Senate Bill 1600 by 10 minutes. All those who are in favor of extending the debate by 10 minutes will please rise at their desks, please. Thank you. Please return to your desks, members. It's imperative that you return to your desks. Representatives Montenegro, Representative David. Thank you. Did you get the one over there? Members, thank you. Okay. Those, please be seated. Those who would like to vote nay on extending debate by 10 minutes, please stand at your desk. Thank you, members. Thank you, members. You may have a seat. The motion carries 32 ayes, 25 nays. There will be an additional 10 minutes of floor time for Senate Bill 1600. Members, I am bound by the rules, just as you are. I'm doing my best to be fair under the rules. Pursuant to Rule 18C, when two or more members rise, the chair shall name the member who is to speak. But in all cases, the member who shall rise first and address the chair shall speak first. The first person to rise was Representative Solomon. We allowed Representative Solomon to speak first and to ask questions. This person who has risen to speak now is Representative Bliss. The chair recognizes Representative Bliss.
Mr. Chair, will Representative Parker yield to questions?
Representative Parker, do you yield to a question?
Barbara Parker.
Barbara Parker.
Mr. Chair, yes, I would love to yield
Please
to a question.
proceed.
All right, Mr. Chair, if Ms. Parker would address the claim the bill requires unnecessary treatment that deprives parents of time with their child to say goodbye.
Yes, Representative Bliss, Mr. Chair, that is not true. This bill will ensure that parents have precious time with their babies. It merely requires health professionals to treat the infant with the same medically approved and reasonable care.
Mr. Chair, may I ask another question of Ms. Parker?
Please proceed.
We've heard people claim that this is a cruel bill, that a woman who has a miscarriage at 15 weeks will have to endure the baby being whisked away for fetal treatment. Could Ms. Parker please address this claim?
Mr. Chair, Representative Bliss, this is just a scare tactic. The language is very clear. Doctors are to treat the baby with medically appropriate and reasonable care. It is not reasonable to think a 15-week baby can survive. Medically appropriate and reasonable care would be simple comfort care. That is what is done now, and that will not change. This bill prohibits the practice of slow coding, in which healthcare professionals do not provide medically appropriate and reasonable care to a baby born alive, usually because they don't expect it to live long due to a genetic condition, not because the baby is too young to survive outside the womb.
Mr. Chair, will Ms. Parker yield to another question?
Do you yield to another question, Representative Barbara Parker?
Yes, Mr. Chair, I would love to yield to another question.
Please proceed.
Ms. Parker, we have another claim we're hearing that's going around, that this isn't about women and babies. It's about trying to establish fetal personhood and eventually ban abortion in Arizona. Would you address this claim?
Yes, Mr. Chair, Representative Bliss, that is not what this bill is about. It is about giving every baby a chance at life and giving parents the assurance that doctors have done everything medically necessary and reasonable to save or preserve the baby's life. It has nothing to do with fetus, unborn baby. It refers to babies already born. This is nothing new. Every baby born is a person. This is not about the baby in the womb, but the baby outside the womb. We heard testimony, from people who fear that the daughter was not given the care she required to survive. And she stated that her daughter was a human being with unmeasurable value.
Mr. Chair, will Ms. Parker yield to another question?
Do you yield to another question?
Mr. Chair, Representative Bliss, I would love to yield to another question.
Please
We have
proceed.
another claim I'd like you to address, that those that say the portion of this bill that allows a woman to opt out of care for the baby born alive must necessarily apply to cases of attempted abortions. Would you address this claim for us?
Thank you, Representative Bliss. No. The bill requires health professionals to provide the baby with medically appropriate and reasonable care. It allows for parents to opt out of care beyond that, but they cannot opt out of medically appropriate and reasonable care, because the baby is a born alive person and is worthy of the same treatment any other human being would receive.
Thank you, Ms. Parker. Would you yield, through the chair, would you yield to another question?
Would you yield?
I would love to yield, Chair.
Please proceed.
Another claim I've heard is that this bill will lead to medical malpractice suits, or that the bill creates uncertainty. Would you please address this claim?
Mr. Chair, Representative Bliss, no, the standards of care are nothing new, and the bill clearly defines those standards. Doctors are very, very familiar with standards of care, and they know what is required of them. In addition, it is of a high burden of proof for prosecutors who would have to prove the doctor knowingly and intentionally violated the law, which could be found in subsection B.
Mr. Chair, will Ms. Parker yield to another question?
Do you yield?
I would love to yield, Mr. Chair.
Please proceed.
Ms. Parker, we also have heard the claim this bill will discourage doctors to practice medicine. Could you address this claim for us, please?
Mr. Chair, Representative Bliss, providing care to babies born alive after an abortion attempt is already required under Arizona law, and it hasn't discouraged any participation for doctors to practice medicine. Physicians have many laws they must follow to ensure ethical and legal compliance.
Mr. Chair, will Ms. Parker yield to another question?
Do you yield?
Mr. Chair, yes, I'll yield.
Ms. Parker, another claim I'd like you to address is that people say this bill is vague, that doctors won't know if they are violating the law. Doctors and healthcare providers, could you address this claim for us, please?
Yes, Mr. Chair, Representative Bliss. This is not true. And we need to emphasize, we have several attorneys here. Attorneys and judges all understand the reasonableness standard in the law, which is as old as the American legal system itself. Medical malpractice law has already worked out this reasonable standard. Physicians are well acquainted with it. And the standard in this bill is the health professional has to knowingly and intentionally not provide all medically appropriate and reasonable care.
Mr. Chair, will Ms. Parker yield to another question?
Do you yield to a question?
Yes, Mr. Chair, I would love to yield.
Please proceed.
Ms. Parker, this is a two-part question. Could you address the claim this bill stokes fear in patients and doctors, as well as calling it too punitive?
Mr. Chair, Representative Bliss, first of all, the claim that it stokes fear in patients and doctors is not true, and it shouldn't and it will not. The bill does not hold a woman or a parent responsible at all. Let me repeat that, please. The bill does not hold a woman or a parent responsible at all. It holds healthcare professionals accountable for violating the law, and only if they knowingly and intentionally do not provide the care. On the second part of her question, where the statement was raised that it's too punitive, or that they could lose their license in a Class 6 felony, or that they would lose their license and be sued, none of that is true. Here's the answer. Penalties for breaking the law are nothing new in our legal system. There are always consequences for breaking the law. In this bill, penalties are appropriate because we are talking about human life and human beings. A born human being reliant on proper care to be provided and to survive. Additionally, the standard is extremely high. The physician would, again, under the law, have to be knowingly and intentionally to withhold that care. And if I could add one addendum to that, I would like to add, my father was an obstetrician and gynecologist for 45 years. And never at any time would this have been a concern on what he needed to do and what he needed to practice and what kind of care he
10
needed
seconds.
to provide. Mr. Chair,
Yes, ma'am.
may I make a comment about the
The
bill
time
that I haven't
has
made?
been reached. I am sorry, members. Under Rule 12I, we have reached the limit of the time for debating Senate Bill 1600.
Thank you, Mr. Chair.
The motion before you, members, is that when the Committee of the Whole rises to report, it gives Senate Bill 1600 a due pass recommendation. All those in favor will vote aye. Those opposed will vote nay. Appears the ayes have it, do have it, so ordered.